Welcome to the Life of Being podcast, where we talk about all things life from a healthcare perspective all around the world. I'm your host, Kelly Tan, and in each episode, we'll explore stories, science, and wisdom to help you live well, think deeper, and express life fully. Let's begin. Today, we're excited to have Wong joining us from Malaysia. Yikai is the president of the Association of Chiropractic Malaysia, senior lecturer at IMU University, and vice president of the Malaysian Society of Association Executive. He brings a unique blend of experience in healthcare, education, and association leadership with a strong focus on advancing the chiropractic profession in Malaysia. Through his work, he actively builds collaborations across government, academia, and industry to strengthen professional standards and public awareness. Yikai is also passionate about creating meaningful conferences and platforms that go beyond knowledge sharing to foster lasting partnerships and real-world impact. Wong Yikai, welcome to the show.
Hi, thank you. It's my pleasure to join.
Well, excited to dive into the story with your wealth of experience and knowledge. Shall we start by you sharing how you got into chiropractic, your story into it, and also your progress towards educator, and then your participation in towards like international chiropractic associations?
That's a very good question and interesting question that I never think to go into chiropractic since the beginning. So since I'm young, I like to be a scientist or mathematician or astronomy and all those things as well. But everything changed after I took my STPM. So it's like A level in the Malaysia version. So my mom suggested, since you like science and mathematics, do you want to try some healthcare professional type of program? So they suggested first with dentistry. Then I don't like dentistry, like looking at people's mouth for the whole day and all those things. So then my mom suddenly said, you want to try chiropractic? Then I was wondering, what is chiropractic? But later I find out that why my mom actually suggested chiropractic is because she's been to a chiropractor when I'm young. That one, I think, is during my primary school. It's actually suggested by one of my primary school teacher to bring her to a chiropractor because of her back pain or quite a long term back pain due to an injury. So since chiropractic have helped her so much during that time, so when after my STPM and IMU is been promoting the chiropractic program quite a bit during that time as a new program and those things. So my mom saw it and they went to try. So actually going into the chiropractic program without knowing the actual detail of chiropractic. But after you go through the 4 years program, I love it quite much as it actually helps us to help with the patients, help with the individual, and also things we can do to help. So think fast forward towards 2014 when I complete my studies, and the next phase is what to do. Like all graduate will think of and what to do. So initially I started as a chiropractic assistant while waiting for convocation or those things. So that's where actually I connect to the president of the association at that time, Chiropractic Association. So he bring me to a bit of history of the chiropractic, how the journey started in the association, on those things. So I think quite a good, interesting stuff as well. For me, I like some secretariat type of work, and also that's how he bring me into helping the association, doing volunteer work and those things. So from there, besides as a clinician, later I joined a few different companies before I joined my current company, which is about 12 years ago. Then it actually helped me to think that besides helping patients, all those things, what can I do? Because in the association, we deal with a lot of policies and all those things as well, developing. Because back then, chiropractic is not recognized by law and all those things as well. So having fight through the journey through actually where we see how the profession revolutionized, I think using the word that changed from unregulated to regulated, and slowly more regulation coming in as well.
Because you're the pioneer batch in IMU chiropractic program, isn't it? So how did chiropractic came into Malaysia? If you can briefly explain that, and also what is the process of getting from unregulated to now being more recognized and regulated by the government and also public?
Okay. Actually, very interesting about the history and background of chiropractic in Malaysia. Because I just know one of the friends actually recognized a book which is written by BJ Palmer. It's on the Around the World with BJ Palmer. It was 1926. That's where actually BJ Palmer traveled the world between 1924 to 1925, around that period of time. And understanding BJ Palmer actually traveled around Asia. Actually, the association actually got the book and actually read through, finding, hey, wait, has he come to Malaysia or not? Because he came to Asia. So actually, by looking through the books and also, I found actually BJ Palmer actually came to, I mean, that time it's called Malaya lah, or they mentioned Federated Malay States at the time.
Mm,
So he actually came to the Malaya and actually commented they visited the Batu Cave, they went to Penang, and they have some rubber plantation that time, not like the Malaysia today that we
yeah.
know. So it's quite interesting to know that actually BJ Palmer come to Malaysia back then. Yeah. And fast forward through the journey, and also, of course, nothing much developed because BJ Palmer, when he came to Malaysia or
Yes.
Malaysia, is as a tourist and all those things, not so much of like promoting chiropractic,
Yeah.
treating, and all those
Yes.
things. Like.
Yes.
So, of
Yes.
course, fast forward, chiropractic actually back then is mainly dominated by foreigners, and also even Malaysian is graduate from overseas. So,
Mm.
when Asian chiropractic program started back in 2010, it actually helped to increase the population of chiropractic in Malaysia. So back then, when I first graduated with less than 30 chiropractors in Malaysia, so now we almost 800 chiropractors. You can see for
Yes.
the past 10 years plus, the chiropractic population actually grow quite a bit.
What is the current scene in the chiropractic in Malaysia, and what are the current challenges that we are facing, and also what's the future trajectory of chiropractic in Malaysia? What are we aiming for?
So for the regulation, as mentioned, there's always a two shot. The sword is always sharp, a two-way as well. So some people might like the regulation, some people might
Mm,
not like the regulation because when things get regulated, things are more stricter in that
mm,
sense. So the regulation actually kicks in 2016 when the whole chiropractic and other profession like Malay, Indian medicine, Chinese medicine, all those things, we group under the complementary medicine for chiro, osteo, and also we have the traditional components. So with that sense, the forefather of the chiropractic and all those group actually fought for an act because back then the traditional and complementary medicine is not regulated or
mm,
in so we use the t&cm, which is traditional, complementary, and integrative medicine, the
mm.
terminology. So it's not so much of regulated and all those things. So people want to get regulations. So with the group of forefathers that actually fight through and all those things, so the act actually gazetted in the law in 2016. Gazetting a law and implementation actually takes some time. Not say that today gazette implement.
Tomorrow,
So
okay.
yeah, so the act actually fully enforced since 2016 until actually last year they are fully enforced because they go by phases. Like first phase when they first form the council
Mm.
or traditional complementary council, they need to draft a law like what qualification. People say, hey, can you practice 10 years? You can become a chiropractor. No, I mean, we still very base mass of a qualification base and we standardize with the CCI or CCA and ECCE and all those international standards. So with all the building blocks of the setting up the regulation, it took quite a number of years, I would say, and
Mm.
COVID hits as well during the time.
Right.
So I think everything actually completed the regulation drafting in 2021. That's when we start to register chiropractor. So people might not know, wow, so early during COVID time, we actually start registering chiropractor already
Mm,
out of
mm.
the other profession as well. So a lot of people might think, hey, yeah, 2000, this give us some grace period to do some registration. So people first started do the registration. People say, hey, delay. So they give us 3 years, the government, for everyone to
Okay.
register. Being Malaysian, I think almost a month, everyone started to submitting
Like,
their
yeah.
applications and government was jam stuck because not just chiropractor, there's also other six
Yes.
professions that they are
Yes. Yes.
regulating. So I think thousands and thousands of application kick.
Wow.
So they actually ended another year to
Okay.
process. But of course, they cut off the
Yeah.
experience route other more like traditional component of the medicine
Mm,
stuff. So of
mm,
course, everything calm down and all those things. So last year, March, they actually fully enforced the whole regulations. So now chiropractic is regulated and you must hold a license from Ministry of Health to practice chiropractic in Malaysia. And of
mm.
course, with that, a lot of more regulation will come in. So now is the practitioner component is regulated. We're expecting the facility, the services will be regulated as well.
Does it usually take a lot of time for it to be discussion, draft, and then like process? Like, when is the next phase of regulation you'll expect, like in the next year or like in the next 5 years in terms of the trajectory?
Yeah. So for the T&CM Act itself, which regulate the practitioner, is still, I would say, infancy, although it start
Mm.
fully enforced, but they haven't really go through the whole journey, like, for example, disciplinary action and all those things. So because when more people enforce, then the consumer know their rights, they will write
Yes.
in also as well. And also a lot like the Malaysian Medical Council is Act 50. Back
Mm.
then, the T&CM Act is 775. You can see, wow, almost 700 plus Act difference. So how many years that there exist. So I think chiropractic and T&CM will go through the same journey, the CPD points, the
Mm.
requirements, like previously the indemnity insurance, all those things, the importance of it. So of course, in Malaysia, we do promote all chiropractors to get their indemnity insurance before they start seeing their first patient.
Mm.
It's actually to protect themselves for any liability, also lawsuits and as well.
Now, with that said, what is it that we can do to help advance the profession forward then?
Yeah, I think everyone or every chiropractor in Malaysia actually play a role in terms of advancing chiropractic. So chiropractic, you can be actively doing like policy related stuff to advance chiropractic. It could be public health related
Mm.
in terms of advancing the chiropractic as well. So people might not know what actually chiropractic is. People might think is it a crick crack crack like this? That's chiropractic.
Mm.
So people would actually confuse. And I think recently some posts and saying that people actually going to see a non-chiro but get injured, but because he thought it's a chiropractor and the
Yes.
name got
Yeah,
damaged and all
tarnish,
that.
yeah.
And I think a few years ago, there's a newspaper actually published that chiropractor raped someone and all things. But we don't know whether there's a real chiropractor. But from the preliminary understanding, it's not a real chiropractor. So,
Mm.
but the term chiropractor is used. People would ask all this stuff. So indirectly, it would actually affect the profession reputation of this as well. So being
Mm.
a chiropractor in the field and supporting, promoting the profession, understanding, doing awareness education to the patients and also to their community around that they are serving as well. And of
Mm.
course, promoting spinal health. People might think, hey, chiropractic is just spinal. Sometimes we also do like joint, not just spine. Because chiropractor, they thought it's just spine, the bone.
Mm. Mm. I guess there's lots of confusion, especially when our message is not as clear, and also there's lots of different confusion from other professionals. So, what pushes you then? What inspires you with so many things that you're doing? You're doing like IMU, you're doing clinician teaching, and then you're doing the policy side, and then there's life in between. So, what pushes you to do your very best every day then?
I think it's the passion, I would say. So
Mm-hmm.
that actually push us or push me at least that what to work, what can I do better or serving? Because for me, I have interest in public health. I have my master in public health and all those things, and I'm
Mm.
doing my PhD in regulation policies and also as well. So it actually let me think that as a clinicians, we can help with one patient at a time, and as a public health, we help as a community. And from understanding taking public health, it actually helped me to think about the health system thinking, or sometimes we use the terminology. It's like, how do you change the health system or the system to better in terms of the whole thing rather
Mm.
than, of course, we still need clinicians on an individual patient basis. We still need public health. We still need the system and all those things. So I think because fortunate or unfortunate that because as a pioneer group and all those things as well. So there's a lot of opportunity, I would say, that all of us, I have friends that actually go into clinicians for many years. So, and recently they actually come and ask me, is there any opportunity for me to give back to the profession, like teaching the students and all those things? So
Mm.
sometimes people, after 10 years of being clinicians, they say, I want to contribute back to students and all those things. Of course, because of my background and have opportunity to meet with the president of the association very early stage, it actually opened up the thinking of working not just clinicians alone, but also the populations, public health, and also the policies and all those.
How would you play a role in changing the health system so that people live a better and healthier lifestyle?
Yeah.
How does that work
So,
here?
so I'm also involved in the policy development with the government and those as well. Of course, nationally and those as well. So with that, actually, like for example, when recently we are working on a few projects, although as I mentioned, the act is there, but we are still not defined the scope of practice, for example. So when
Yes.
we talk about scope of practice, people say, a chiropractor can do this or A or B or C. Different countries have their own scope. Depends on all law and all those that actually join together what you can do. And chiropractic, we are developing that. So
Mm.
I think for the past year plus, we are actually working on it. So we actually drafted almost 50 pages of the scope of practice for chiropractic, and not just doing locally, but we actually consult international. So we ask the
Mm.
World Federation of Chiropractic, the International Chiropractic Regulatory Society, which they have experience, which
Mm.
we are able to utilize their expertise and experience they have to improve Malaysia. So we might not want to start as, or like some country they have here, or they're not so good, they change and change. But
Mm.
why not just learn from the people? So
Yes,
we actually
yes.
get consulted with all the international people. We have experience and expertise, and we drafting Malaysia. So hopefully, I mean, we just have a meeting some time ago last month
Mm.
to do a standardization. So of course, all seven profession will be drafting our own scope of practice. Of course, at the end, we need to buy in from the Ministry of Health and all those as well. So of
Yes.
course, the project is under Ministry of Health as well.
Mm.
So we
Mm.
planning if everything good this year or next year, hopefully we have a better scope. When chiropractor being asked, why you do this, why you do this, we can say, we are following our scope of practice. Our patient is not happy, or not. Unfortunately, if you go to the legal case, then
Yeah.
you have a document from the Ministry of Health to support us as well.
Yes, yes. So it's good that, some people, like you mentioned, it's double-edged sword. Some people feel like being regulated is bad, but at the same time, it also helps with protecting us if we're doing according to the scope of practice too. Is there any shift or mindset shift you had when, now that you're 10 years into the profession, is there anything that has changed your mindset compared to before you started chiropractic school?
Yeah. I think, of course, as a student, when it started, you just want to pass exam. Okay. So once you pass exam, what is next? So I think like I share my journey a bit just now is that after graduate, what is next? So there's
Mm.
opportunity that when I move into the association, where system thinking and also that help to develop in that sense as well. So
Mm.
I think that a lot of people might think they have their own journey, different timeline. So like some of my friends, after 10 years, they want to contribute. I think in that sense, I will think that from the advancing initially, when I first joined association and also working with Ministry of Health, first we work with relations. So when you know people, you say, hey, can you see what is, and all those is very important role. So sometimes, hey, I thought we know everything, and also, but having good relation with certain organizations, certain people, actually able to understand better in terms of how things work. So sometimes, hey, I think things should work like this, but sometimes work like A, B might be better. So I'm learning throughout the 10 years, I'm learning my ways and how to work things better and all those as well. And of course, next, beside Malaysia, I also involved in the regional as well. So we see how we can actually advancing the regional of chiropractic. So Asia actually, if I'm not mistaken, hold one of the biggest population around the world, but chiropractic is also a very small amount. So
Yes.
I think the accessibility to chiropractic, all those is very important as well. And very
Mm-hmm.
important, I think, during the early chiropractic world in Asia as well, that a lot of chiropractor might not able to practice in their region or their
Mm.
country, come to Asia because they look at the big pie that they can actually get earn some money. So actually, when the president that time very firm saying that Asia is not a dumping ground for those chiropractors not able to practice in their
Yes.
country. We are trying to work one country at a time. So
Mm.
Malaysia, we started, and throughout the journey, we are getting better. Like Singapore, they are fighting for regulations. Some other countries as well. So not
Mm.
just about regulation, but also education. Because nowadays we talk about health workforce. So when the workforce is like less, so how do you help with the people? One people might only can do work for one people, but when you have a group of people, things will get run faster. That's why I think Malaysia able to improve quite a bit is because of the workforce that we have, the health workforce. Like
Mm.
initially, back in 2014 when I graduated, the time is about 30. Now we have about 800. So with 800 people working, creating awareness, and think if you are in Malaysia or you came back to Malaysia, especially Klang Valley, you can see, almost every few corner
Everywhere.
there's a car.
Yeah.
Compared to back then, how many 100 kilometers you get by one Cairo. But now
Yes.
maybe how few kilometers you can fill a few Cairo. So I think
Mm.
it actually create a help workforce and most then and awareness will go up. Okay. So I think the next project will be working with the local regionals and all those as well. How we can help each other to bring the profession and also the education component to the next level in the Asia region.
I guess comparing to where you were being the pioneer, was it difficult to explain what chiropractic is to people and also the difference between chiropractic and, say, physiotherapist? Was it difficult for you being the pioneer batch?
Yeah. So yeah, last time a lot of people, even patients, they will ask, what is chiropractic, physio or bone setter or all
Yes.
those things. So then we need to explain a little bit more. Education is very important. But
Mm.
nowadays, of course, the time social media not so as well or viral. So of
Yes.
course nowadays things are getting viral, social media. So people would understand a bit chiropractic, but they sometimes would think that chiropractic is just cracking bone as well because the things
Yes.
that we do is very similar. We do something rehabilitation, similar like physio, sometimes some
Mm.
component. When we do manipulation, some people also say, bone setter also do the manipulation component or the real TCM, traditional Chinese medicine, also do that. So they say, hey,
Mm.
what's the difference? So they will more Westerners, English educated that compare chiro and physio and osteo. The
Yes.
more, I would say, Chinese or more
Yes.
Eastern mindset would say that, hey, what's the difference with bone setter, TCM, and all, the
Yes.
BOMO and all those things. So we see these two type of different questions. And even nowadays, we still have patients saying that, hey, can you crack me up? Then sometimes after checking, hey, we need to send you for X-ray or MRI first before we can do
Yeah.
because we and people sometimes patient are upset. Huh, I come to see you, you don't do any
Yeah. Lor.
adjustment that they're expecting. So education is very important. So we actually the day I also encounter one that we explain to the patient that adjustment is not hard to perform. But if
Mm.
there's any underlying issue when we do a manipulation, it might harm you, which we
Mm.
don't want to. So I
Mm.
think educating and the patient understand that. Once the patient understand that you are doing good for them by not manipulating, they appreciate it more as well.
Yes, yes. Because ultimately, what they want is getting better. So, if you don't, if what you're not doing is helping it, then they understand it. When you meet those questions, what would you say is the thing that makes chiropractic a separate and distinct profession then, from your perspective?
Okay. So I think when people ask, like using bone setter like in Asia a bit more
Yeah. Common, yeah.
I mean, quite common. So I said, okay, so I don't know what bone setter do. I mean, you've heard them doing cracking, but
Mm.
I can say that chiropractic, when we do any manipulation or adjustment, it's because we find not just a restriction, but the principle behind is that as we know, chiropractic stand on art, science, and philosophy. The art is the adjustment. So you might heard, you see people doing adjustment, bone center doing adjustment. But what happened is the philosophy and also the science is different. So when we talk about science, we talk about evidence informed, evidence based, and also as well. So I think a few years ago, there's a publication in Hong Kong. They use I think 10 or 20 years data to say that what's the adverse effect of chiropractic, but big organization using retrospective, and we not really have any major side effect, the adverse effect and all those as well. So there's the sign about the safety component, all those things as well. And also people say, hey, how about the conditions and all those as well? So we look at research, like there's also Lancet paper saying that low back pain, mechanical low back pain, chiropractic, and those things. So we actually stand firm on the science component and
Mm.
also philosophy. Then is the chiropractic we started as a nervous system. How does the nervous affect? Because like connection wire lah, the term
Mm.
usually, yeah. So then people say, hey, how about osteopathy? Because people will say, then we say, osteopathy might be using different principle and all those things. So there's actually differentiate what chiropractic and bone setter. Last time my lecturer told me that if you train a monkey well, they can do adjustment as well. Because it's just mimicking the component, but they don't able to say, clinical thinking. Even I last time when I was in a chiropractic center, the clinical assistant actually in the chiropractic center for more than 20 years. And surprisingly, I mean, out of curiosity that time, so she palpated me, it's feel okay. It's like maybe year three students palpation. Okay. And also they can do adjustment as well because they have been looking at the staff
Yes.
for 20 years, must have learned something as well. Of course, they are not trained intensively like us. So that's why I say a 20 years experience equivalent could be a year three chiropractic students. Yeah, so
Mm.
they have the palpation skill and those things, but it's still very different. They
Yes,
don't
yes.
really look at the component, they do anatomy and all that.
Easy to, make sounds and correct things, but it's understanding what you're doing and understanding that helps with the nervous system and how the body express better that makes it different, isn't it?
Yeah.
So if you have a billboard of a message where everyone could read it and understand it, what is it that you want it to write so that people can understand?
As in to the public
Yeah,
or
yes, to the public. A
professional
billboard
itself.
message where everyone in the world can read it and understand what is it that you want people to understand.
Something along the line is like if you service your car every 6 months, you need to service your body every 6 months or more or less, depends on your lifestyle as well.
What sort of books or resources, if someone wants to understand deeper in terms of health or life, and also how they can better help advance the profession forward, what sort of resources you would direct them to, or books?
Okay. I think there's a lot of books around the world and all those things that helping. I think back many years ago when I first joined the World Federation of Chiropractic, they come out with a book. I can't remember the exact title. It's about green color like this. So they actually talk about the global chiropractic and those things. So they actually talk about the history of chiropractic and all the globalization. So I think a lot of chiropractic students and also when they step into the profession or they're going through the journey beside want to graduate, then what is the next step? Sometimes people might think just to a clinicians, but those people who think big, they want to understand what is a global happening. Because nowadays it's not like last time that no social media, I just do locally, but nowadays social media is so wide.
Yes.
And you want to know what is happening. So for example, when we are complaining bone setter and those things issue in Malaysia, same thing could be happening in other country in Asia as well. Or even, if I'm not mistaken, last year or some years, something like that, that Brazil also experienced some issue with regulation of chiropractic. If you don't think outside of the box or think bigger, you wouldn't know.
It sounds like your connection early on helped you to think bigger and think outside the box. Was it something that you're always curious about and then you just like search more and then you met people, or like how did you got into where you are then? Are you just like lucky or something, or?
Yeah, I think it's really like the perspective that I get early of the year is like when I graduated, when I worked as a chiropractic assistant, to meet the president of that time actually open up my mindset. Beside the degree of chiropractic is what can go further. And I think that time he was 80 plus years old. He still signed up to study master in law in one
Wow,
of the
okay.
yeah, we can see that beside the chiropractic degree and those things, being 80 plus years old, still have the passion to study the law, master, so that he can contribute to the regulation in Malaysia, understand the Malaysian law and those things. So it actually inspired that, like in Chinese, there's one saying that you learn as you age as well, or in English, we say lifelong learning lah.
At the moment, what is it that you're learning then, Yikai?
Of course, from time to time, we read a lot of books. And of course, with my PhD, I focus more on the policies related matters related to chiropractic and those as well. And on-hand project is the scope of practice. Hopefully, there's a lot of reading as well, because reading like UK, Australia, and all those things, after reading, maybe a few years later, there's a new one. So you need to updated as well. So when, of course, it's a live document, Malaysia also do mention that it would change because like cultural change, the acceptance level change and those as well. So I think it actually always reading. I always tell my students as well, do you follow the Ministry of Health website? Because sometimes they post certain things. And do you follow, for example, the chiropractic social media, the World Federation or so that when what is happening in the current chiropractic world, not just that study, come out, what is happening in the chiropractic world? What happening? So there's a lot of things actually developing, or a lot of people there. So sometimes they will call for a support and all those as well. So as students or as a part of the profession, how we can contribute helping the people. So like mentioned Singapore, so they are trying to fight for regulation. So like when they ask for help in Malaysia, we support them. So we give them how we work, what is the regulations, and when people want to set up schools in overseas, they say, hey, how do you and all those things. Of course, system might be different, but in terms of principle, we are same that regulation is to the profession, the public, the education is to increase the workforce and all those as well.
We're coming towards the end of our conversation today. I know we just started talking a lot about all this different, how do you change policy, regulation, and helping moving the profession forward. Where would be the best place to find yourself or find more information from yourself? If you have any website or email that people can send to if they have further questions or they are curious to be like you.
Okay, I have a LinkedIn profile. Okay. So those who are interested to connect or if they want to see what is the happening in the Malaysia, the regional or even beyond, actually can follow my LinkedIn. I do post news about chiropractic, what I have been doing and those as well. So to stay updated. Great. And also if you're interested more wide chiropractic related stuff like WFC, social media on all those as well, they do post a lot of stuff from time to time as well.
That's great. I'll link your LinkedIn and also the WFC website into the description below. So anyone is interested to talk more of chiropractic, you can just reach out to you and also reach out to WFC. Before we stop the recording, what is one phrase, one sentence you'd like to leave the listeners to?
So there's one things that I always link back when I have conversation with one of my friends saying that if you are not at the table, you are on the menu. So if you want to do a change and you want something to change, so you need to involve and participate as well. So be involved. Don't scared to be involved in certain things. So although there might be uncertainty, you might feel nervous, but still step forward and contribute wherever you can.
That's a really great way to end the conversation. Thank you so much for your time in terms of sharing your story and sharing your experience. And we look forward to speak more again in the future.
Yeah, sure. Thank you very much. Thank you for the opportunity.
Thank you for tuning in to the Life of Being podcast. Let us know what is your one key takeaway from this episode. And if this conversation inspired you, share it with a friend who might find it helpful today. Until next time, take care of your health and take care of your being.